And welcome back, everyone. As the world marks World AIDS Day, the fight against HIV is entering its fourth decade. Progress is being made in many parts of the world, with infections and death rates falling. We'll have a closer look at the numbers in just a moment, but first, a report on a region where the problem is still getting worse. In Eastern Europe, infections have been rising quickly over the past 10 years, mainly in the heterosexual community and among drug users. Ukraine is especially hard hit. Well, we paid a visit to a hospital in the city of Odessa, where a pioneering doctor has devoted her career to ensuring that mothers do not pass the virus on to their children.
An unexpected visitor has stopped by Dr. Svetlana Posakova's practice. Alina has good news she wants to share with her. Her baby Masha has received a clean bill of health. Alina was diagnosed HIV positive 16 years ago. With Dr. Posakova's help, she's since given birth to 3 healthy children.
We're just as nervous about the test result as the mother is. It's wonderful when there's good news, like with Alina, who has 3 healthy children. It feels good to have been of help.
She's given me a second chance at life. Since my children were born, I've got a reason to live again. I have a future, and I want to see my children grow up.
Odessa has the highest per capita rate of HIV infection in Europe. Experts believe 1/10 of the population is infected. And it's not only the poor. The middle classes are also living with HIV. Svetlana Posakova began her career as a doctor trying to save newborn children from HIV. She received advanced training abroad and passed that knowledge on to her colleagues.
At the end of the 1980s, as the first pregnant women with HIV began turning up in our clinic, we were powerless to help them. Doctors and staff were afraid they would get infected. We even burned HIV patients' bed linen.
Thanks to cesarean sections and new therapies, over 95% of babies born here to infected mothers are healthy. Dr. Posakova treats pregnant HIV-positive women from all over Ukraine because they know she will not discriminate against them.
In the past, HIV patients were isolated in our country. They were marginalized. In our clinic, they share the same wards as non-infected patients, and we maintain confidentiality because HIV cannot be transmitted by air.
Alina has recommended Dr. Posakova's clinic to many other women. She's learned that having a child can give her the hope and strength she needs to live with her HIV infection.
Well, as we heard there, HIV infections are still growing in Ukraine and around Eastern Europe. In other parts of the world, there's a downward trend. The UN's Millennium Development Goals aim to halt the spread of AIDS altogether by 2015, but that leaves just a few years to act. Here's more on the progress the world has made against AIDS and how much more needs to be done.
This is a typical AIDS test today. It didn't exist 30 years ago when the disease first emerged. Today, the incurable condition continues to claim millions of victims. But over the past decade, the numbers have been decreasing. In 1997, 3.4 million people got infected with the human immunodeficiency virus that causes AIDS. In 2010, the number of new infections had gone down to 2.7 million. In 2005, 2.2 million people died of AIDS. In 2010, that figure was 1.8 million. And more people than ever are managing to live with an HIV infection thanks to new medications and improved access to them. That's helped save millions of lives, particularly in impoverished areas like Southern Africa. UNAIDS, the United Nations program on HIV and AIDS, has now presented a comprehensive action plan for the upcoming years. The aims are to end new infections by 2015 by focusing on better prevention. AIDS deaths are to be reduced to 0, thanks to more widely available medical treatment. And the plan calls for an end to discrimination against HIV sufferers. UNAIDS is aware that this is a vision and that it's unlikely to realize the goals in just 4 years. One of the main reasons for this will be the declining funding of AIDS projects due to the global financial crisis.
Well, one group that is especially vulnerable to HIV is sex workers. And there, Thailand has made big strides in protecting people. Estimates suggest that it cut annual infections from more than 140,000 in the early 90s to just under 20,000 last decade. Government policy has played a role, but NGOs are just as important, distributing condoms, providing education, and overcoming taboos. Well, we went to see one group at work in one of Thailand's most popular holiday spots.
This is an English lesson that could save lives. In this school on Thailand's resort island of Phuket, the class isn't just learning how to say hello and how are you, but also more graphic vocabulary.
When you go with customer, you save a condom, you use a condom.
The students are sex workers in the popular vacation spot. It's this woman's 5th time at the class. The 26-year-old enjoys learning English.
English is important for me, so I can ask my customers if they use condoms. If not, then I can say no.
These lessons have been organized by Empower, a non-profit organization designed to support sex workers, to educate and counsel them and make them more aware of their rights.
Empower has contributed in a significant way to the fall in the number of people affected by AIDS. We deal directly with the prostitutes. We tell them to go to a doctor if they're sick. We also tell them to find out more about HIV.
Empower is fighting to break with taboos on subjects like sex, condoms, or HIV/AIDS that Thai society tends to avoid. Relatively few people, like these students, are willing to talk publicly about sex.
At college, you learn about protecting yourself from AIDS, to use condoms when you have sex. You find that on brochures and posters at the university.
When you have sex, you should use condoms. Men and women both have to take responsibility.
I haven't had sex yet, but when I have sex, I will use a condom.
It's evening, and Empower's work is far from over. 13 women head for the streets of Phuket's resorts to pass out condoms. The female and transsexual prostitutes and the tourists seem glad to get the free rubbers. Tonight, the women managed to distribute 13,000 of them.
At Empower, we're proud of our work, and we plan to continue it in the future so that prostitutes can protect themselves from AIDS and other diseases, so they can live longer and not die from them.
Thailand has practically no state-run education or health programs for sex workers because officially prostitution is illegal. That makes the work of organizations such as Empower all the more important.
AIDS, putting prevention first. That has been our in-depth report today. I'm Brent Goff in Berlin. As always, thanks for watching and thanks for the company, everybody.